Hello, iPrevent friends and family. This is Allison, project coordinator with the Prevention Department at Odyssey House, Louisiana. February is an important month to recognize and celebrate Black history. We wanted to take the time to bring you what we are calling Black Healthcare Excellence. The people we will be discussing today are all amazing examples of triumph in the face of extreme adversity. Follow along and get inspired with us. First up is Dr. James McCune Smith. The Smithsonian Magazine writes that James McCune Smith was not just any physician. He was the first African American to earn a medical degree, educated at the University of Glasgow in the 1830s, when no American university would admit him. For this groundbreaking achievement alone, Smith warrants greater appreciation. Smith was also one of the nation's leading abolitionists. In 1859, Frederick Douglass declared, "No man in this country more thoroughly understands the whole struggle between freedom and slavery than does Dr. Smith, and his heart is as broad as his understanding." A prolific writer, Smith was not only the first African American to publish peer reviewed articles in medical journals, he also wrote essays and lectures refuting pseudoscientific claims of Black inferiority and forecast the transformational impact African Americans were destined to make on world culture. He was also the first Black person to own and operate a pharmacy in the United States. The information that follows comes from the American Association of Medical Colleges. This is Rebecca Lee Crumpler, MD. In 1864, after years as a nurse, Rebecca Lee Crumpler became the first Black woman in the United States to receive a medical degree. She earned that distinction at the New England Female Medical College in Boston, Massachusetts, where she also was the institution's only Black graduate. After the Civil War, Crumpler moved to Richmond, Virginia, where she worked with other Black doctors who were caring for formerly enslaved people in the Freedmen's Bureau. While she faced sexism and other forms of harassment, Crumpler ultimately found the experience transformative. "I returned to my former home, Boston, where I entered into the work with renewed vigor, practicing outside and receiving children in the house for treatment, regardless in a measure of remuneration," she wrote. Crumpler also wrote a book of medical discourses in two parts. Published in 1883, the book addresses children's and women's health and is written for mothers, nurses, and all who may desire to mitigate the afflictions of the human race. Next, we have Dr. Leonidas Harris Berry. Even as a renowned gastroenterologist, Leonidas Harris Berry, MD, faced racism in the workplace. Berry was the first Black doctor on staff at the Michael Reese Hospital in Chicago, Illinois, in 1946, but he had to fight for an attending position there for years. "I have spent many years of crushing disappointment at the threshold of opportunity," he wrote to the hospital's trustee board in his final plea, "keeping my lamps trimmed and bright for a bride that never came." He was finally named to the attending staff in 1963 and remained a senior attending physician for the rest of his medical career. In the 1950s, Berry chaired a Chicago commission that worked to make hospitals more inclusive for Black physicians and to increase facilities in underserved parts of the city. But his dedication to equity reached far beyond the clinical setting. He was active in a civil rights group called the United Front that provided protection, monetary support, and other assistance to Black residents of Cairo, Illinois, who had been victims of racist attacks. In 1970, he helped organize the Flying Black Medics, a group of practitioners who flew from Chicago to Cairo to bring medical care and health education to members of the remote community. This is Dr. Charles Richard Drew, known as the father of blood banking. Charles Richmond Drew, MD, pioneered blood preservation techniques that led to thousands of life-saving blood donations. Drew's doctoral research explored best practices for banking and transfusions, and its insights helped him establish the first large-scale blood banks. Drew directed the Blood for Britain project, which shipped much-needed plasma to England during World War II. Drew then led the first American Red Cross blood bank and created mobile blood donation stations that are now known as bloodmobiles. But Drew's work was not without struggle. He protested the American Red Cross's policy of segregating blood by race and ultimately resigned from the organization. Despite his renown for blood preservation, Drew's true passion was surgery. He was appointed chairman of the Department of Surgery and chief of surgery at Freedman's Hospital, now known as Howard University Hospital in Washington, D.C. During his time there, he went to great lengths to support young African Americans pursuing careers in the discipline. This is Dr. Lewis Wade Sullivan. Lewis Wade Sullivan, MD, grew up in the racially segregated rural South in the 1930s. There, he was inspired by his doctor, Joseph Griffin. He was the only black physician in a radius of 100 miles, Sullivan said. I saw that Dr. Griffin was really doing something important, and he was respected in the community. Over the decades, Sullivan became an equally profound source of inspiration. The only black student in his class at Boston University's School of Medicine, he would later serve on the faculty from 1966 to 1975. In 1975, he became the founding dean of what became the Morehouse School of Medicine, the first predominantly black medical school opened in the United States in the 20th century. Later, Sullivan was tapped to serve as Secretary of the U.S. Department of Health and Human Services, HHS, where he directed the creation of the Office of Minority Programs in the National Institute of Health's Office of the Director. Sullivan has chaired numerous influential groups and institutions, from the President's Advisory Council on Historically Black Colleges and Universities to the National Health Museum. He is CEO and chair of the Sullivan Alliance, an organization he created in 2005 to increase racial and ethnic minority representation in healthcare. Here we have Dr. Marilyn Hughes Gaston. In a pivotal experience while working as an intern at a Philadelphia General Hospital in 1964, Marilyn Hughes Gaston, MD, admitted a baby with a swollen and infected hand. The baby suffered from sickle cell disease, which hadn't occurred to Gaston until her supervisor suggested the possibility. Gaston quickly committed herself to learning more about it and eventually became the lead researcher on the disease, which affects millions of people around the world. She became Deputy Branch Chief of Sickle Cell Disease Branch at the Nation Institute of Health, and her groundbreaking 1986 study led to a national sickle cell disease screening program for newborns. Her research showed both the benefits of screening for sickle cell disease at birth and the effectiveness of penicillin to prevent infection from sepsis, which can be fatal in children with the disease. In 1990, Gaston became the first Black female physician to be appointed Director of the Health Resources and Services Administration's Bureau of Primary Health Care. She was also the second Black woman to serve as Assistant Surgeon General, as well as achieve the rank of Rear Admiral in the U.S. Public Health Service. Gaston has been honored with every award that the Public Health Service bestows. Interning in New York City in the 1960s sparked a revelation for Dr. Patricia Era Bath. Bath, the first African American to complete an ophthalmology residency, noted that rates of blindness and visual impairment were much higher at the Harlem's Hospital Eye Clinic, which served mostly Black patients, than at the Clinic of Columbia University, which served mostly whites. That observation spurred her to conduct a study that found twice the rate of blindness among African Americans compared with whites. Throughout the rest of her career, Bath explored inequities in vision care. She created the discipline of community ophthalmology, which approaches vision care from the perspectives of community medicine and public health. Bath blazed trails in other ways as well, co-founding the American Institute for the Prevention of Blindness in 1976, which supports programs that protect, preserve, and restore eyesight. Bath was also the first woman appointed chair of ophthalmology at the U.S. Medical School at the University of California, Los Angeles David Geffen School of Medicine in 1983. And she was the first Black female physician to receive a medical patent in 1988 for the laser phaco probe, a device used in cataract surgery. As the first director of the Office of Minority Health at the U.S. Department of Health and Human Services in 1986, Dr. Herbert W. Nickens set the foundation for promoting improved health among racial and ethnic minority populations across the country. When he left the HHS, Nickens moved to the AAMC, where he was the founding vice president of the AAMC Division of Community and Minority Programs, now known as Diversity Policy and Programs. He led Project 3000, which the AAMC launched in 1991 to achieve the goal of enrolling 3,000 students from underrepresented minority groups in the U.S. medical schools annually by the year 2000. No one in recent memory did more than Herbert Nickens to bridge the painful and persistent diversity gap in medicine, said then AAMC President Jordan J. Cohen, MD, after Nickens' death in 1999. The AAMC continues to remember Nickens' legacy with 3 namesake awards honoring outstanding medical students, junior faculty, and individuals who have made significant contributions towards social justice in academic medicine and healthcare equity. Dr. Alexa Irene Kennedy nearly dropped out of college due to a crisis of self confidence, but ultimately went on to achieve dramatic success in medicine. In 1981, she became the first Black neurosurgeon in the United States, and just a few years later, she rose to the ranks of Chief of Neurosurgery at Children's Hospital of Michigan. Kennedy worked for decades as a successful pediatric neurosurgeon and was ready to retire in Florida of 2001. But she donned her surgical scrubs once again to practice part time at Sacred Heart Hospital in Pensacola, where there was a dearth of pediatric neurosurgery services. Kennedy has been lauded for her patient centered approach to care, which she said was a boon to her career. I was worried that because I was a Black woman, any practice opportunities would be limited. But she noted, by being patient centered, the practice growth was exponential. Dr. Regina Marcia Benjamin, MD, MBA, may be best known for her tenure as the 18th U.S. Surgeon General, during which she served as the first chair of the National Prevention Council. The group of 17 federal agencies was responsible for developing the National Prevention Strategy, which outlined plans to improve health and well being in the United States. But it's not just her work at the highest levels of public health that earned her praise. Long before she was appointed the nation's doctor in 2009, Benjamin worked extensively with rural communities in the South. She is founder and CEO of Bayou Clinic in Bayou La Bachcherie, Louisiana, which provides clinical care, social services, and health education to residents of the small Gulf Coast town. Benjamin helped rebuild the clinic several more times, including after damage inflicted by Hurricane Katrina in 2005 and a fire in 2006. Of the clinic, she said she hopes that she is making a difference in her community by providing a clinic where patients can come and receive health care with dignity. According to the EEC.edu, Dr. Jane Wright analyzed a wide range of anti cancer agents, explored the relationship between patient and tissue culture response, and developed new techniques for administering cancer chemotherapy. By 1967, she was the highest ranking African American woman in the United States medical institution. Jane Wright graduated with honors from New York Medical College in 1945. She interned at Bellevue Hospital from 1945 to 1946, serving 9 months as an assistant resident in internal medicine. While completing a residency at Harlem Hospital from 1947 to 1948, she married David Jones Jr., a Harvard Law School graduate. After a 6 month leave for the birth of her first child in 1948, she returned to complete her training at Harlem Hospital as chief resident. In 1955, Dr. Wright became an associate professor of surgical research at New York University and director of cancer chemotherapy research at New York University Medical Center and its affiliated Bellevue and University hospitals. In 1964, President Lyndon B. Johnson appointed Dr. Wright to the President's Commission on Heart Disease, Cancer, and Stroke. Based on the Commission's report, a national network of treatment centers was established for the disease. In 1967, she was named Professor of Surgery, head of the Cancer Chemotherapy Department, and Associate Dean at New York Medical College, her alma mater. At a time when African American women physicians numbered only a few hundred in the entire United States, Dr. Wright was the highest ranked African American woman at a nationally recognized medical institution. While pursuing private research at the New York Medical College, she implemented a new comprehensive program to study stroke, heart disease, and cancer, and created another program to instruct doctors in chemotherapy. In 1971, Dr. Jane Wright became the first woman president of the New York Cancer Society. After a long and fruitful career of cancer research, Dr. Wright retired in 1987. During her 40-year career, Dr. Wright published many research papers on cancer chemotherapy and led delegations of cancer researchers to Africa, China, Eastern Europe, and the Soviet Union. Lastly, we have Otis F. Boykin. From blackpast.org, Otis F. Boykin was an inventor. He earned his first patent in 1959. He developed the wire precision resistor, which enabled manufacturers to accurately designate a value of resistance for an individual piece of wire in electronic equipment. 2 years later, in 1961, Boykin earned a patent for an improved version of this concept, an inexpensive and easily producible electrical resistor model with the ability to withstand extreme accelerations and great temperature changes without change or breakage of the fine resistance wire or other detrimental effects. Boykin's invention significantly reduced the cost of production of hundreds of electronic devices while making them much more reliable than previously possible. The transistor radio was one of the many devices affected by his work. Other applications of Boykin's invention included guided missiles, televisions, and IBM computers. Additionally, Boykin's device would enable the development of the control unit for the artificial heart pacemaker, a device created to produce electrical shocks to the heart to maintain a healthy heart rate. Boykin created the electrical capacitator in 1965 and an electrical resistance capacitor in 1967, as well as a number of consumer products ranging from a burglar proof cash register to a chemical air filter. In all, Boykin patented 26 electronic devices over the course of his career. Follow iPrevent across all social media platforms at iPrevent_OHL. Visit our link tree for more videos and our podcast. See you next time.